of the unnoticed symptoms of diabetes, symptoms that often go unnoticed. They are frequent symptoms, much more frequent than those usually known as diabetes symptoms. The person drinks a lot of water, frequents the bathroom a lot, urinates a lot, even wakes up to urinate, loses a lot of weight, and is always hungry, eating everything in sight. These symptoms only occur when your blood sugar, your glucose, is too high. So usually they are attributed to type 1 diabetes or type 2 diabetes, which is more common when blood sugar is very high, usually in a later stage of the disease. And now, most of the time, you won't have 450, 500, 400 there. You will have a milder change in glucose, which will already have caused many damages to your health, which is the case for most people. Just to give you an idea, type 1 diabetes corresponds to 5%. In some populations, even less than 5% of all cases of diabetes, and type 2 diabetes is more than 90%. And usually it's going to start that way slower in a more insidious way, nibbling at the edges, as they say. And when you realize it, when you feel these symptoms I mentioned, then you're already in a more advanced stage. Often you even already suffer from the consequences of the disease. That's why it's important for you to take note of these overlooked symptoms, to seek help and prevent consequences, or to prevent you from suffering even more consequences. Let's set a goal of 10,000 likes for this video, 1,000 likes for each symptom. Anyone who can help in this way, YouTube will distribute more of this content and we can alert the millions of people who have diabetes and don't know it. Precisely because they don't connect the symptoms I'm about to discuss here with the rise in blood sugar. What are the 10 symptoms? Number 10, changes in breath. Why? Because a mild rise in blood sugar can greatly increase the chance of you having gum inflammation, a tooth infection, for example, which can cause bad breath. If the sugar level continues increasing, then it would be a more advanced symptom of the disease. You may have keto breath. The body can't metabolize it properly due to a change in insulin. And then you can eliminate ketone bodies, which give a very strong smell to your breath. But pay attention to tooth infections and also gum inflammation. Number 9. It can cause impotence. Indeed, it can cause impotence by both affecting the blood vessels and altering hormonal balance. There's an alteration in the hormones producing testosterone, for example, in LH. A hormone stimulating the testicular production of testosterone. In women, hormonal changes can also occur, causing what? A reduction in libido. So it does happen. This must be directly associated with changes in libido due to blood sugar. Number 8. Infections. Here I will include fungal infections like athlete's foot, ringworm in the feet. It significantly increases because when you slightly raise your blood sugar, it's a feast for microorganisms like bacteria and fungi to multiply. So skin infections, ringworm on the skin, nail infections, urinary tract infections, especially recurrent urinary tract infections, must always be linked with the level of blood sugar. Urinary tract infections in men, too, always have to be investigated. It becomes a bit more challenging with recurrent infections in men, but any type of infection, especially if you never had it before, investigate to see if it's not due to the level of sugar in the blood, because this has been proven to increase. Because your white blood cells, your defense cells, are impaired. The increase in sugar hampers the effectiveness of these cells. So you only observe this in practice. You even take the test, that blood count test. You see the count is normal. The doctor even tells you that your immunity is good, but then in practice you have many infections. It could be due to the sugar in the blood. Number 7, acanthosis. These are darker spots on the skin, mainly in the regions of folds. Here then on the neck, in the armpits. Why? Because the excess insulin, when you have insulin resistance, it can stimulate the proliferation of a type of cell in the skin, and it manifests in this way, with the darker spots, I am sure, not that you have, because there's no guarantee, but I'm sure that you've seen someone on the street or know someone who has these dark spots. So if you see someone with this, alert them, because it could be a sign of diabetes and resistance to insulin. This happens in type 2 diabetes, Remembering the difference, it's another thing you always ask. In type 2 diabetes, you have insulin. Sometimes you have too much insulin, but the insulin doesn't work. The insulin can't get the sugar from the blood into the cells, into the muscles for you to really have energy. In type 1 diabetes, which usually happens with the symptoms I talked about at the start of the video, you will not have insulin. Why? It's an autoimmune disease that destroys the cells that produce insulin. So what happens? Sometimes you had normal sugar last week. You even took a test. You started with symptoms and the sugar was very high, 500, 550, sometimes even higher than 600. Why? Because you don't have insulin production, so you're going to have symptoms faster. That's why I said that most type 2 diabetes can go unnoticed because it happens little by little. Number 6, change in vision. Here, if you already had a problem, this problem got worse. Or if you didn't have any kind of change, you started to have difficulty seeing. Always check if it's not blood sugar. Why? Because the glucose molecule can pull in water, and this can change your vision even suddenly. And also, in the long term, you can have the so-called diabetic retinopathy and have a lot of consequences because of that as well. So whenever you have a change in vision, note it. If you take this message from the video, I'll be very satisfied. Why? Because changes in vision are closely linked. They can be with an increase in blood sugar, okay? Then worsening of diseases that you already had. Pay attention to that. Number 5, burning. One of the main causes of burning in the feet, but it can happen in the hands as well, is precisely the increase in blood sugar, tingling. Sometimes people refer to it as tingling, but when you go to bed, you feel your foot burning. So pay special attention because diabetes, the blood sugar, even a slight increase can cause what's called diabetic neuropathy. You have a loss of neurons, they can be attacked, let's say, by the increase in blood sugar. So whenever you have a burn, pay attention and do the exam to see if you don't have diabetes. An initial change, let's say a milder change, not so early because you already have a complication, which is diabetic neuropathy, but a slight level of increase, a lower level of increase, can cause this as well. Symptom number 4, scarring. You've been beating, you bump into the little one, and you get that cut. It takes time to heal, so pay attention. Also, when you have other types of cuts, you have noticed that your healing is slower. It is also a symptom of diabetes. It takes longer due to damage to the cells, and it can also happen due to vascular involvement. It's not always that more serious disorder, but sometimes you may notice it's taking longer to close a wound. So pay special attention because it is indeed a symptom that often goes unnoticed. Why am I saying it goes unnoticed? Why am I so sure about this? Because I've been dealing daily with diabetics for over 10 years and sometimes not always the patient mentions it. Sometimes you have to ask a focused question. Oh, and the healing? Then he starts to think about it more because it goes unnoticed. You'll never think, oh, it took so many more days to heal. Oh, it could be the blood sugar. No, it goes unnoticed altogether. I get it. I put myself in the patient's shoes. We come to the last 3 symptoms that go unnoticed. And this one is very interesting. Why? It's abdominal bloating. You get stuffed. That stuffing, it gets heavy. It gets hard for you to do activities after you've eaten. Sometimes you haven't even eaten fatty foods in such quantities and you feel like you're getting a lot worse. Why? Because high blood sugar even at slightly higher than normal levels, can cause diabetic gastroparesis. What is it? Your intestinal transit slows down, so your stomach takes longer to empty and you feel like you're too full. I'll never forget, there are things that tell you you mark it for the rest of your life. The person came in and said, it feels like I ate a cow, I ate a sandwich, feels like I ate a cow, I'm so stuffed. Then I conducted the investigation and it turned out to be diabetes. It already had a high rate. This was further confirmed with other tests. It was causing diabetic gastroparesis. So it's crucial you pay attention to this as well. If you eat something small, I'm not talking about all you can eat pizza here at a steakhouse, then yes, you'll feel very stuffed. But if you've eaten in small quantities or foods that aren't fatty foods and you're feeling like you've eaten a cow, then that's your cue to investigate to see if it's not diabetes. Number 2, fatigue, that chronic tiredness. And here, I don't mean extreme cases, the person who lies in bed all day. I'm talking about that fatigue you feel. Another thing they've told me I've scored as well, it feels like they put those balls You know, they put it on so people don't run away. It looks like they put it on my leg. I'm walking. It looks like it's heavy. Why? Because when you have an impairment in sugar metabolism, the sugar is elevated in the blood, but you can't take advantage of it in a proper way in the muscles. Then you're going to have tiredness or fatigue, that chronic fatigue. And the number one that I would like to draw attention to here is precisely reactive hypoglycemia. Hey, what's that? Why hypoglycemia? It's not when it's too low. So reactive hypoglycemia can precede type 2 diabetes because your body has already increased production of insulin begins, and when you eat mainly sugar, this simple carbohydrate, it produces even more, which will generate hypoglycemia reactive. And how are you going to identify that? When you eat, for example, after 30 minutes later, you start sweating, you get trembling or feeling palpitations, so you have to pay attention and investigate to see. If not, it is the blood sugar that is greatly reduced because of a change in insulin. Did you like the tip? Was it worth your like? So click on the like, subscribe to the channel for more videos like this. Now I'm going to leave a suggestion for you to watch. It's a video that I talked about the 6 worst foods in the world, those foods that you will avoid. Do you want to know what they are? So watch this video here. A hug.